Okay, so let's continue our discussion about START or simple triage and rapid treatment. So again, START is a method, no? It is a method or the procedure that we use in doing triage or sorting and tagging victims. Okay, so what does START mean again? It's simple triage and rapid treatment. Okay, so unsa man ni siyang START? So START was developed to allow responders to triage multiple victims in 30 seconds or less. So based on three preliminary observation. What are these three preliminary observation? R for respiration, P for perfusion or circulation, and M for mental status. Again, RPM. These are the three observations that we need to take note of as we do triage using the START procedure. R for respiration, P for perfusion or circulation, and M for mental status. So again, as I said, triage was actually developed to allow first responders to sort victims in just 30 seconds. No? 30 seconds ra ang pag-assess. Okay? So 30 seconds or less. And based on the three preliminary observation, RPM, R for respiration, P for perfusion or circulation, and M for mental status. Okay, so the START system is designed to assist rescuers to find the most seriously injured patient. As more rescue personnel arrive in the scene, the patient will now be re-triaged. So, unsa man ni siya, designed ko no for the rescuers to find who is the most severely injured. Because you will categorize, di ba? So, isorting man nato. So, this is one way para mabala nato kinsa may pinakagrabe ang situation. Kinsa man ang kanang possible nga mamatay. Diba? So mo to'y unahon nato og transport, may unahon nato og apply og treatment para ma-save pa sila. Okay? So, once, pero dili ka, as you do the initial sorting, no, or the initial triage, it doesn't mean nga mauna gyud na tagging niya. So, let's say, for example, green tag siya. Kaya nga man, pag initial assessment nimo, kuan man siya, okay ra siya, minor injury. But then, how come pag retriage na nahimo na siyang yellow or red? Meaning, there's something going on inside, no? Nga possible pag initial sorting nimo wala nakita pag initial assessment. Dito na siya nakita pag no? Pag reassess na, no? Sa uban ng mga rescuers. So, pagbuhat na sa retriage. Okay. So, this system allows first responders to open blocked airways and stop severe bleeding. So mo gini siya first, no? We are considered, if you do the triage, you should be the first responder, of course. Ikaw yun na adiha sa actual na scene. So, kung sa dito, if for respiration palang daan, ang breathing palang daan naglisod na, then we need to open the airway immediately. And then as you open the airway, if there is severe bleeding, stop the bleeding. Control the bleeding. Diba? Para dili mo grabe. So, kuan palang daan, breathing palang daan, wala na, plus severe bleeding, immediate tayo na siya. Pwede na siya mamatay. The patient can go on a shock in a few minutes or in a few seconds. Okay? So, mo na siya. Now, when you do triage tagging, you tell others what you've found. Of course, sultian yun na mo siya. Unsay imuhang na-recognize, unsay na-observe nimo. So, there are different methods, no, for you to determine, methods to help determine, no, kung unsay nahitabo. So, our local emergency services, no, gigakuan na sila. So, depende sa color tagging. That's why buhatan nila color tagging. That way, it will be easier to recognize kung kinsay severe, kinsay minor, kinsay pwede pa ma-delay, no? O kinsay wala na joy chance na matabangan pa, patay na siya. So, mo nang gikuan na sila color tagging. So, what are these color tagging? Colored surveyor tape, no? You use tape, you can put it over the arm, they can put it over the wrist, no? And they can use flags, colored flags. So, green. So that these are the color tagging. No, you have the green, the yellow, the red, and the black. Now green, unsa man green tag, green color tag. So meaning delayed care can delay up to 3 hours. So pwede pa siya, makahuwat pa siya after up to 3 hours, no, para matambalan. Meaning minor injury. They're actually called the walking wounded. Hindi na sila walking zombie, ha? Walking dead. They're the walking wounded. So, pwede pa na sila ma-delay, no? As long as ma-secure na lang yun sila, mag-transfer na lang sila sa safer area. So, they are called the walking wounded, the green tags. No? So, these are the victims categorized on the green tag. No, minor injuries can be delayed up to 3 hours. Next is the yellow tag, yellow color tag. So, ang green again, also known as minor. If the yellow, it's called the delayed. Urgent care ang gikinahanglan yellow tag. They need urgent care, but it can be delayed up to 1 hour. So, pwede pa 1 hour, no? Na ma-delay ang ilahang treatment. So, but urgent care na, no? Kinahanglan na gid sila og treatment, no? So, dili na pwede mo lapas. Ayaw huwata og 1 hour. If you can give the treatment in less than an hour, then do it. Because they need urgent care. But, pwede lang sila ma-delay. That's for yellow tag. Next is for the red tag. No? Red color tag, considered as immediate. No? Immediate. So, immediate care, agad-agad, kinahanglan ni sila treatment agad-agad because the situation is already life-threatening. Pwede ikamatay nila ang ilang situation karon. Okay? So that's immediate or the red tag. And the last one is the black tag, dead. No? Victim is dead, no care needed. So pawahi sila. Now, is there a possibility nga si black tag pwede na siya mahimong red tag? Yes. Possible nga nag-cardiac arrest ra na siya diha. Maong na-tag siya as black. But then, pag-apply na, pag-triage na niya, base nahimo na siyang red. So, pwede na siya. So, it doesn't mean nga black tag na siya, biyaan na lang na nalak, dahil na siya mabuto na siya diha sa building. No. They still need to be transported. Okay. Now, what is the first step in the start method? So, first step. Step 1, get up and walk. So, now, emergency. So, naana ka sa scene. Okay? Dito na ka. You are the first responder and you are now starting to sort out. You will now be applying the start method. You will now be categorizing, no, what's the injuries, no, nga na-incur sa victim. Okay. So, first step, for you to remove the minor victims or the green tags, get up. You tell them to get up and walk. Okay. I am here to rescue you. I am here to help you out. For those who are still able to stand up and follow me. So I will be bringing you to a much safer area for you to get treated. So, katong makabarog o makalakaw, they will definitely be standing up and they will follow you. So now you've already eliminated, so na-remove na nimo ang mga minor, na ay mga minor injury or the green tags. No? So meaning ang nabilin dito are just the yellow, the red, and the black tags. So once all the green has already moved out, no, from that area, then you then start, no, checking, no, kung sa kay possible injury nga no, wala naman ni nakabarog and wala naka-follow ang uban. So, first step. Okay, so, noto, get up and walk. And then, so if a patient complains of pain on attempting to walk or move, do not force him or her. For example, there's one victim who is trying to stand up and walk. Pero maglisod siya. Gahilak siya kay sakit. There's pain. So, ayaw po sa. No? Possible yellow na siya. Okay? So, patients who are left in the place are the ones whom you must now concentrate. So, katong nabilin, adto na din ta mag-focus dito. So, that is now step 1. Get up and walk. Next, step 2 is, begin where you stand. That's the second step. So, sa to, first step is get up and walk. You are now asking those minor victims to stand up, yeah, and follow you. Second step is begin where you stand. When you say begin, no, the meaning of begin where you stand is, unsa man, you are moving from where you stand. Auto, do not jump from one victim to another. Be systematic. Okay? Ayaw pag laktaw-laktaw o patient. So, move from where you stand. Move in an orderly and systematic manner through the remaining victim, stopping at each person for quick assessment and tagging. And then you stop. No, the stop at each patient should never take more than 1 minute. Pila ra ganito, dapat 30 seconds ra gyud ang assessment. Okay? So, unsa to? What do we need to remember? Your job is to sort. No? Your job is to tag immediate patients, those who require immediate attention. So, make sure that you check them correctly and correct life-threatening airways and breathing problems are always tagged as immediate. As you tag immediate, as you tag them with red, move on to the next victim. Okay? So, how do we evaluate victims using the RPM? So, unsaon man? So, to? R for respiration, P for perfusion and circulation, and M for mental status. So, how do you check for respiration? So, mo ni siya. If the patient's breathing, diba? What's the normal breathing of respiration of an adult? So that's 16 to 20 breaths per minute, diba? So now, what if ang iyahang breathing is greater than 30 per minute? 30 cycles. Pas-pas kaayo ang iyang ginhawa. So, you already can now tag the victim as immediate. That's too fast, no? And that's not normal because the normal is just 16 to 20. Pas-pas kaayo. Na, so these patients are showing one of the primary signs of shock. Meaning there's possible shock. Tachycardia na siya. No, pas-pas ra kaayo ang iyahang pagginhawa. Okay? Now, if the patient is breathing less than 30 cycles per minute, 30 breaths per minute, move on to circulation. So, hinay kay ginhawa. Gamay ra ka, hinay kay siya, less than 30. So, how do you check for circulation? How do we check? How will we know nga maayo ang circulation ni victim? So, you do the blanch test. No? You do the blanch test. That's when you press on the nail beds and check how many seconds mo balik ang pag-circulate ang dugo. That's how you check for circulation. Okay? So, as you check for circulation, kung dugay gani, ganing red balik ang nail bed as you press on it, immediate na siya. Okay? So, tag na dayon si victim as immediate. Okay? Sa ganito, respiration. If there are as you assess the victim, more than 30 breaths per minute, automatic, itag siya og immediate because that is a possible sign of shock. Now, if the respiration is less than 30 breaths per minute, you move on and check for circulation. No? Is oxygen getting well? No? Is there a proper flow of oxygen in the body? So you do the blanch test. Press on the nail bed. No? Muluspad na siya at first, pero mubalik na ang circulation in less than 2 seconds. If more than 2 seconds, if it takes quite some time, no, before the circulation to go back, then we have an issue with circulation. So you can now tag the victim as immediate. Okay? Tag the victim as immediate. Now, kung wala. So, for example, if the radial pulse is absent, no, pag-check nimo sa pulso, wala man. And then, hinay ang iyang respiration. So, immediate gihapon na siya. Okay? So, tag the victim as immediate. Now, if the radial pulse is present, then you move now to check the mental status.